a non-issue speaks to character, where you take, as a former prime minister, where you take ownership of a project that clearly was not yours. It's not about taking ownership of a project and the political to-ing and fro-ing. If we cannot trust our leaders to be truthful to us on small matters, which can be so easily disproved, how can we trust leaders to be truthful to us in larger matters? And that's the problem.
We have a brand new hospital in Arima, built by this government, and I'm going to open it on Tuesday. That hospital has been dedicated to the handling and our operations in the COVID response. We've got a brand new hospital in Point Fortin, paid for and built by this government. That too was reserved for COVID.
If we cannot trust our leaders to be truthful to us on small matters, which can be so easily disproved, how can we trust leaders to be truthful to us in larger matters? And that's the problem.
That is the problem. That is the problem. And your prime minister, the only liar bigger than you is your prime minister. From Emailgate, from Renaissance, from Sheep Farm, from Landate, from Manning, from Obia Gate, come down the line from Delcy Rodriguez Gate, from Astrobal Gate, from San Fernando Hospital Gate, Arima Hospital Gate, Port of Spain General Gate, ConVont Hospital Gate, and then you, Mr. 351,000 vaccines that you call answer my call for and ask them for money and then come and say nah. And you, Mr. Terence Dial Singh, you who said there are no Venezuelan with any variant, that is not easy, there's no information, the information does not provide any facts about any Brazilian variant. Then next 2 days, well, yes, well, the first one who got it was a Venezuelan illegal immigrant. Ethelbert, you take that question. Who could trust you? Number one, you're a dunce. And number two, you're a dishonest dunce. You is what they call a DD. Next video.
Last night, a desperate person is now questioning the medical competence of doctors and nurses and indicating that government is guiding the hands of healthcare workers in making decisions. In defending the integrity of our doctors and nurses, these people have been our salvation for the past 14 months. They have won the admiration of our people, our region, and the world. And they have been doing back-breaking work. They are mentally tired, physically tired. And now, to be dragged into the political foray, where I am quoting the Newsday today, medical personnel are playing God with lives, determining who lives and who dies. Is it that some people are seeing themselves as God? This comment is bringing our public officers into odium.
This comment is not bringing the public officers and the doctors and nurses into odium. It's showing your incompetence. The doctors are, yes, you are correct. The doctors are the ones who have to make the life-changing decisions based on the resources that they are allocated to make sure that they do the best job for the people. So if there are only 9 ICU beds with ventilators and there are 30 patients. Unfortunately, because of your incompetence, because it is your job to provide the doctors and the nurses and the staff, those healthcare workers that you are trying to pretend like you care about, that you have not paid them any bonuses for 14 or 15 months, that they have been working and putting their lives at risk, that you have not taken care of them, that you have not provided them with enough ICU beds, that we have the lowest ICU bed rate probably globally. You are the one who forces them to make these hard decisions because you have not done your job. Your job as Minister of Health is to get in the cabinet, get the resources, and buy the equipment in vast numbers to make sure that our doctors do not have to make those difficult, heart-wrenching decisions. So you are to blame. Nobody is discussing our doctors, and you are trying to, and Dr. Parasram and Dr. Hines. If your number one advocate is the ConVont Gyul, you know you're up the creek without a paddle. If he, Mr. Muena mask don't make no sense, PCR test at private lab ain't no good, make a jersey into a mask, your COVID not coming. And if that is the only person to defend you, my goodness, good thing you wasn't charged for murder or else he is hangman, because that man is the epitome of incompetence. So it is your job as Minister of Health to get resources, PPE, oxygen, ventilators, beds, spaces, and you are describing 2 tents from the USA as a project? You have no shame, ConVont Gyul. You have no shame whatsoever.